Hello, this is Dr. Daniel Farkas, and I want to talk to you today about functional neural health and your return to balance. Again, I'm Dr. Daniel Farkas, DC CFMP, and I want to ask you, struggling with feeling stuck, anxious, having poor sleep, being inflamed, struggling with acid reflux, fighting SIBO, having irregular heartbeat, you're suffering with something called POTS, are you feeling reactive to everything, including food and supplements? Are you having issues being dizzy, woozy, or wired but tired? Do you struggle with libido or menstrual issues? Loose bowel, slow bowel, or constipation? Chronic urticaria, which is hives that you get when exercising, or stress-reactive inflammation? Or is it something else, or a different combination of things that you think could be related to your nervous system? Whatever you're concerned about, please watch the following and consider if this applies to you. So I want to talk about this nervous system component, and I want to describe what's called the autonomic nervous system. Now, this is just our background nervous system that runs all the things in our body we can't control, like our heartbeat, our digestion, and more. Just understand that there are pretty much two big parts to it. On the right, there's a part that helps us deal with stress. That's called the sympathetic nervous system. Stress happens, our body has to adapt to it, the sympathetic nervous system swings into action, but when that gets activated or stays activated, something else happens. On the left side, we see what's called the parasympathetic nervous system activity, which has to do with our ability to reproduce and have normal hormone production, run our immune system, digest our food, and our ability to rest and relax and turn our mind off. So you know this, we are living in a stressful environment that can throw this out of balance. And it can give people a lot of organ and system symptoms that are really rooted in stress. And this is how it works. So notice too, there's a nerve called the vagus nerve. That this is a part of that autonomic nervous system, probably one of the main parts, I think, that connects the brain to all the organs and systems of the body, the lungs, the heart, the liver, the stomach, and especially the intestines and the gut. This nerve needs to function properly. Quality information needs to flow back and forth from the organs to the brain and back, especially from the gut, in order for all of this to work right. Otherwise, we can get problems and short circuits, if you will. You may be familiar with the whole brain-gut, gut-brain connection. Oh boy, is this important. The gut and brain, they're like a married couple or people in a deep relationship. They need to communicate. They need to work together. They are the key players and the key components of the body. And some people say that the gut is actually the little brain. There's a big brain in the head, and then there's a little brain that's in our gut. These things are so important. They must get along, and they use the vagus nerve to communicate. Understand, too, that trillions of bacteria live in the gut, and they actually communicate with the brain. This is how it works. This is the gut-brain connection. Trillions of bacteria sending messages along that vagus nerve by electricity, influencing the brain, and these bacteria secreting chemicals that get into the blood that influence the brain. Now, you could imagine you'd sure like to have healthy, balanced bacteria and a great functioning gut, so the brain gets good messages and good information and responds appropriately, runs the body in healthy balance. Problem is this, some bacteria promote inflammation. And there are, like I say, I hate to say it, there's pro-inflammatory bacteria that drive inflammation up, they trigger immune activity, they create unnecessary inflammation. And this is just a small piece of a test that I do with virtually all my clients. It's a simple at-home stool test that shows significant levels of pro-inflammatory bacteria. And what these are doing, they're influencing the brain and immune system to go into hyperactive mode. This can suck the energy and life out of people. It can cause the immune system to attack the skin, the joints, and other organs. Totally unnecessary. Something else that happens in the gut. We call it leaky gut. This means that the protective inner lining of the intestines is broken, and it's allowing obnoxious things into the bloodstream that trigger the brain, bother the hormonal system, bother the immune system, and more. And we have a saying, leaky gut means leaky brain. If obnoxious things are sneaking into the bloodstream, they will bother the brain and further annoy the immune system and everything that it controls. This needs to be evaluated, and it needs to be fixed. So just think, the brain is trying to use the vagus nerve to communicate with all the organs and systems of the body, and it relies on information it gets from all these organs. Just imagine what happens if that gut is out of order. If the bacteria are not populated properly, if there's leaky gut or other problems in there, what effect it would have on the brain, as well as all the other innocent organs in between: stomach, liver, heart, lungs, kidneys, testes, ovaries, adrenal glands, and more. So what drives these issues? Stress. We're living in unprecedented stress levels, primarily also these days because of electronics and what they do. They are helpful, but they are also harmful, as we're finding out. A poor food environment, I'm sorry to say, with food that's loaded full of things that damage the gut, that damage the bacteria, that give us leaky gut. Medications, of course, medications are, sometimes necessary, but we know we're over-medicated and we use them too much and the side effects are terrible. And I'd also say that no brain and gut health education and support is in place. They taught us how to brush our teeth and floss our teeth, but nobody taught us how to take care of our brain and our gut. I think especially children born today, they really, really need to understand about this. So just remember, when all this gets out of whack, pretty simple concept. Stress goes up, even good busy stress of life, and our normal body function goes down because our brain can't do everything all at once. It has to prioritize. And unfortunately, one of the bigger picture issues is when this happens, the body goes into defense mode. It goes into inflammation mode, and it can inflame the nervous system, the circulatory system, the respiratory system, the digestive system, and even the skin and the joints. This is what happens. Creates a lot of concerns. For all these symptoms that can pop up, we can get really worried about healthcare costs, drug side effects, and really difficulty just functioning, sleeping, enjoying life, all the things that we work for. Something as simple as sleep, not having unnecessary pain. You're not just struggling with behavioral health for no reason. And this just is all when you put it all together, it completely robs us of our peace of mind. So what's the ordinary approach when we have these symptoms, when we have these problems due to the stressful environment we live in? Medications are used, they're attempted to try to bring things into balance. Diets that can be difficult and not sustainable. Of course, there's the watch and wait while our symptoms just evolve into worse diagnoses. And then the guessing that comes about too, spending time on the internet, trying to search around and figure out what to do. So good news is this: we've created what we call the functional neural health method that includes advanced functional gut testing done conveniently at home and an advanced functional neurological test, unlike anything you've probably ever heard of and seen. And don't worry, there's no needles, there's no electricity, no poking or anything. So when it comes to the advanced stool testing, we use a convenient at-home test that uses what I feel is the most advanced method, and that we use genetics now to screen for the presence of good and bad things, all the things I've talked about: good bacteria, bad bacteria, leaky gut, and more. And it doesn't check your personal genes, but again, it looks for evidence of those things. And we use these indicators and then apply the information to what our clients' complaints are. And then we typically find things that are driving their health problems in a huge way and steering their brain off course. And just remember, there are these pro-inflammatory bacteria out there. Rarely do I ever see someone coming to us that doesn't have these or have them pretty severely. But the good news is it can be helped. These things can be eliminated and we can replace them with healthy good ones. Now, the functional neurological assessment, this is crucial. This is going to measure how well the nervous system is actually working. Is it in balance or is it out of balance? And we always start with a simple at-home screening for our clients. And part of the screening is we just some of the things that we check for is, can somebody actually even gargle water for 30 seconds? Can they even hold their breath for a minute? We give them some simple balance exercises to do and then a simple brain teaser. And when people fail this lets us know how severely impacted their nervous system is. And what's great is almost immediately we can reply and start to give some foundational, what we call brain-based exercises to bring the teeter-totter back into balance. Now, for those with severe problems that are very advanced, in the office in Troy, Michigan, we do an in-office functional neurological exam. And again, there's no needles, no poking, no drugs, no anything. And it's going to go a lot more in depth for those who have serious concerns. Which brings me to a point that with this approach, there is no cookie cutter anything. There is no one size fits all. We always do what people need, but we start with the simple brain and vagus home health assessment. It takes barely 5-10 minutes. It's actually kind of fun. Our goal is we want to get this vagus nerve and this nervous system working with the brain and the gut and all the organs in harmony, sharing information, encouraging and supporting all the parts of the body. This is the way it's supposed to be. We know this happens. Autonomic nervous system, it does what it does. Stress goes up, all these other body systems go down, and they leave us in a real state of dysfunction. And it's pretty hard to medicate all this stuff away. Hard or near impossible. So let's talk about good news now, like a transformation of like a brain gut, just overall brain gut function, what that looks like. I feel for many, the path forward is this: get the gut in order, eliminate inflammatory invaders, repopulate beneficial bacteria, heal the leaky gut, and decrease this inflammation response, and get people independent away from things that they might need to help their digestion. Antacids, steroids, antibiotics, all the random things that are out there. I will never tell someone to or to not take a medication that's been prescribed, but routinely we do see people getting away from needing that type of support so they can truly have balance. And now when it comes to the neurological part, we want to assess that nervous system balance. We want to start with a screening immediately. We want to stimulate and exercise the weak areas of the nervous system immediately. This is something that can start right away, and restore nervous system and balance, to reset the organs in the body system malfunction so people can become balanced and independent. So I always say, don't guess, do a test. What you could expect: stool tests for bacteria balance and leaky gut, and the many other things that we check for, as well as that vagus nerve assessment for nervous system function. Along the way, we use only an all-natural support using special things known as medical foods. Now, there's no medicine in them, but these are special powder blends specifically formulated for certain health conditions. All natural, designed to heal up the gut, along with anti-inflammatories, properly stair-stepped probiotics, leaky gut healing support, and that crucial vagus nervous system stimulation, as well as some simple lifestyle do's and don'ts. We typically work with people over the course of around 60 days, sometimes 90 days, and some people need more care. But we found that that's a reasonable amount of time to get things moving in a big way, in a better direction. What we want is this gut-brain connection working for you. We want to get your gut back on your side and get this couple, this married couple, this involved couple, communicating and working in harmony again for the sake of the organs and for the sake of you. I do feel that the goal for many, whatever their goal is, that the goal being just to return back to balance. Some people have very specific goals. They want to get back to exercise and they want to sleep. They want to get away from their medications. They want less inflammation. I do feel like the pieces of the puzzle are what is going on with the nervous system and what is going on in the gut. So here's some things to expect. Your process begins just like this. Simply set up a convenient consultation with the doctor. That can be done over the phone or by video call, even for convenience, if you're anywhere in Michigan. People come to see us from all over. People travel from far to come and see us in the office. You're welcome to do so. You can discuss your entire health history leading up to your current problems, and this is going to include going all the way back to your birth. Once we move forward, when we know it's a right fit, you'll receive your at-home stool test kit, and on the first day we talk, you can perform your initial at-home vagus nerve screening, and those things we can reply right away with things you can start doing about that immediately. Just be prepared to discuss all of your results quickly too. This doesn't take a month to get stool test results back. We usually get them back in about 7 business days. And we're going to use all of this information to create a customized plan with your goals in place and in mind. Now, along the way, expect this: be in close contact, one-on-one with the doctor. Use the all-natural support, including medical foods, the stair-step probiotics and anti-inflammatories to restore normal gut function. Perform your simple yet powerful vagus nerve stimulation exercises to improve the quality of the gut-brain connection. Remember, these are simple and they're fun little exercises. They only take a few minutes a day. Perhaps you'll need, if you have something more involved going on, perhaps you'll be working one-on-one with the doctor in the office just temporarily while we get you independent and get you trained to take care of yourself. And we're always here to guide you along the way. are definitely going to need to observe healthy boundaries for stress, to exercise appropriately, sleep appropriately, and live a simple and sustainable low-inflammatory lifestyle. And remember, through this, you'll stay in close contact with us and communicate all changes you're experiencing directly to the doctor and the staff regularly. Now, when it comes to outcomes, no two people are alike. In over 20 years of doing this, I've never seen two people have the same problem. But what I do see regularly is when people commit and when they do a good job of following along with recommendations, when they do their exercises, when they get their gut right, when they start avoiding the bad things that got them into trouble in the first place, it is rare if ever that we see someone that does not move in an upward direction. Again, plan to work with us initially for about 60 to 90 days. That's a reasonable amount of time to move the needle in your favor. So when it comes to getting help, it's easy. If you haven't already done so, please find us at bacthealthnaturalsolutions.com. There are a lot of easy opportunities there to set a time to connect with us. We look forward to helping you. And I'm Dr. Daniel Farkas. Be well.